disrupted.
America that I fought.
Weird thing to happen. Hello, one and all. Welcome to this edition of Kitz Corner. It's been a fantastic day so far. So we got some disturbing news, folks. Very disturbing news coming from Canada. Just when you thought our Canadian government couldn't get any worse with the horrendous bills of C-11, C-18, C-63, which is going to censor us completely, and all the other horrendous bills that are just demonizing more people, that are epitomizing our Canadian citizens. This one is deeply alarming because not only is it restricting people's rights and access to our health care, but also just gives up our national sovereignty to a global conglomerate. And I had a feeling this was coming because of what COVID taught us and what the pandemic response on a global scale taught us. And this was kind of the end result of it that's now coming into Canada. So, incoming Bill C-293, the ghoulish numbers of Bill C-293, which is known as an act respecting pandemic prevention and preparedness, which in layman's terms means that this bill inevitably gives up our sovereignty as Canadians, as a Canadian country, to have a global conglomeracy like the WHO, the WEF, and other World Health Organizations to take control of our government, to take control of our ministries, to control us during the next pandemic. Deeply alarming, folks. Deeply alarming. And this is back in June of this year, June 5th, 2024. They did the third reading. And not really much word of this from the mainstream media. Not a lot of word of this on the mainstream media. That's why it's taken me so long to even cover this, because I really didn't even know this bill was already, halfway down almost to the end zone there. But it is deeply alarming, folks, which is why the Canadian Independent wrote this in Substack, because you won't see this any other publication. And they said that new Canadian Pandemic Act has the potential to infringe on civil liberties, violate individuals' health privacy, grant broad powers to the Ministry of Health, and much more. So this is what's deeply alarming about this, folks. It's in the details. It's what's between the lines. It's the fact that they're trying to mimic this as some sort of safety bill, as a precaution for the next pandemic, even though we don't even know what happened during the last pandemic. And we're not allowed to ask questions about the last pandemic. We're still not allowed to ask what happened with that Wuhan lab. We're not allowed to ask if Fauci's going to get prosecuted, which he won't. I know for a fact he won't. But we can't ask those questions. So how are we going to prepare ourselves for the next pandemic if we don't even know what happened during the last one? Ironic, huh? So it goes into detail. Bill C-293, the Pandemic Prevention and Preparedness Act, which has passed its first reading before the Senate, aims to establish robust measures to mitigate future pandemics. However, a closer look reveals several concerns related to government overreach, health privacy, possible violations of civil liberties, and unclear priorities. One of the primary issues in this bill's establishment and interlinking of surveillance systems for infectious diseases, both domestically and internationally. The extensive data collected proposed, especially with international linkages involving organizations such as the World Health Organization, United Nations Environment Program, the Food and Agriculture Organization, and the World Organization for Animal Health. No kidding, folks. No kidding. That's all linked to this. Raises significant privacy concerns. This could lead to widespread monitoring of citizens' health data, potentially without their explicit consent, which was kind of already the ArriveCan app that they were trying to force onto Canadians to monitor people when it came to COVID, make sure who got the jab and who didn't get the jab. That was already kind of a beta test. That was already kind of a beta test for what this is going to reveal. The ultimate plan is to have complete monitoring of people, that we could track and surveil and monitor and decide whether you're allowed to do certain things and whether you're not allowed to do certain things because of compliance, and whether being infectious diseases or climate change that we're trying to pass this through. Whatever the case may be, this is how they overreach. This is their potential plan. This is how they want to live in a feudalist technocratic society where we're just going to be monitored like a bunch of lab rats and give up our sovereignty, because this gives us permission to these organizations to allow them to exploit the Canadian government. So you don't have a democracy, you don't have a say, you don't have leadership. That's all gone to these organizations. And you know who's behind these organizations. The legislation also mandates collaboration between the federal government, provincial governments, and Indigenous communities to collect and share health data. This requirement may create data privacy, security, and misuse concerns. Other troubling aspect in this bill: broad discretion granted to the Minister of Health and other relevant officials. They are empowered to set pandemic preparedness standards and make far-reaching decisions about public health responses, surveillance, and commercial regulations. The absence through oversight of parliamentary approval for such decisions raise concerns about transparency and accountability, potentially allowing political interests to take procedure over public welfare. You mean how, like COVID, our government didn't have any really scientific response to their measures and just took advice from pharmaceutical giants like Pfizer and Moderna and AstraZeneca? The fact there was no scientific analysis or principle to back masking, to back the 6 foot distance rule. There was no scientific analysis for that. There was no doctors, there was no charts, there was nothing. There's no scientific analysis for that. But there was political interest. There was business interest. That's why your mom and pop store, who is, on board to, cleansing and making sure they care about the customer, had to shut down and lose their business. But places like Amazon and Walmart and Loblaws, big conglomerates that didn't really care much about public health, were allowed to stay open. And 70% of businesses, small businesses in Toronto alone, were forced to shut down. 70% of businesses in Toronto, just Toronto alone, were forced to exit out during the pandemic. Just keep that in mind, that they shut down small businesses and still continue to dismantle small businesses. Another troubling aspect is, Furthermore, the bill compiles the Minister of Health and other officials to leverage international expertise by adopting international developed pandemic prevention measures. Great. This could result in Canada aligning with global standards that don't necessarily reflect its domestic needs, limiting the country's ability to make independent public health decisions. So this is why this is concerning. This is why it's alarming, because this whole entire bill, no matter how much gobbledygook, no matter how many times they say it's for your safety, it's for public health, it's for, the prevention of future disease, no matter how many times they fool you with this, what it really involves is the fact that our Canadian government is going to sacrifice itself. We will no longer have sovereignty. We don't have a decision based on our citizens, based on our health data, and that's going to be sent to some global conglomeracy that's has no acknowledgement of Canadians or Canadian standards or Canadians' domestic needs, and going to be sent over there, and they're just going to enforce these mandates due to totalitarian regimes on these countries that are implementing these bills. Because not only is it happening in Canada, they were trying to do that in the United States. I know Australia had similar measures. UK are trying to do something with this too. It's amazing that all these nations seem to have very similar bills that almost seem like we live in this world where we don't even have countries anymore. We don't have our own decision making. We don't have what's best for the needs of our people. But yet, somehow, it's being transferred to some global power that really runs everything. Isn't that interesting? And people think that was crazy, 10, 20 years ago. So, I want to show this because this is inside the bill. This is inside the bill. These are key highlights of this. So, the one thing that they want to point out is this One Health organization. This is the conglomeracy that's being developed in response to lowering the pandemic response and how it's going to be a global wide technocratic center to make sure that we're prepared for the next pandemic, which started in China, ironically. And it says, whereas One Health approach, a multisexual and multidisciplinary collaborative approach that focuses on the human, animal, plant, and ecosystem health and welfare interface, is central to preventing the risk of future pandemics. I didn't realize the virus transferred through your bank account. Maybe that's why Chrystia Freeland blocked people's finances during the riots, during the Freedom Convoy. Is that it? Because bank accounts were being infected by COVID? She was trying to prevent, disease traveling from bank account to bank account, from TD to Scotiabank. Is that what they're saying there? Welfare interference. I didn't realize that had to be a health measure. That your bank account was affected by, upcoming diseases that are being implemented. But who backs One Health? So that goes into here that someone uploaded and did some background research. Supported by the Bill and Melinda Gates Foundation. Surprise! Surprise! The same people that run the WHO, the same people that are responsible for the vaccine response because Bill Gates has patents on the vaccines, which is why he is able to go on media and different outlets to talk about how he's so renowned as a medical science, even though he has never graduated college. He is not a medical scientist. He's barely a tech guy. He's barely a tech guy. He's a good monopolist. He's a good cartoonish evil villain. But he is not a businessman. He is not a good medical scientist. He is not a tech wizard that people claim him to be. And people think of him as some sort of kooky nerd. But really, he's an evil, sick, twisted bastard for stuff like this. Because he buys up all these entities to take control of the entities. Just like how he buys up farmland. Just like how he's buying up all the tech industry. That's why he's coordinating with government officials to, coordinate with the CIA so Microsoft can be the home of the cloud storage for all your information. So, supported by the Bill and Melinda Gates Foundation and academic community for One Health action has been proposed by Shanghai Jiaotong University in Shanghai, China, with the aim of promoting and understanding contribution and real-world implementation of the One Health approach towards the Sustainable Development Goals. Sustainable Development Goals. I thought this is about preventing future outbreaks. I thought they cared about human health. I thought they cared so much about, making sure the population gets vaccinated, which is very safe and effective according to YouTube standards. I thought that was the whole point of this. Oh, maybe there's a sinister plot afoot. Maybe, just looking into it, and if you really understand the mind of Bill Gates, which I don't recommend for people because once you get into that, holy crap, it could scare you. It could scare you. I'm telling you, this guy is a mega supervillain. This guy makes Lex Luthor and all the comic book supervillains that you thought growing up was the worst ever seem milquetoast. compared to this guy. And he wears a sweater vest. He wears a sweater vest to cover all the evil and heinous stuff that this organization is capable of. So really, it comes down to business. It comes down to their development goals, their overreaching of governments to enact these horrific policies to master control and gain empowerment throughout all these different countries, give up their sovereignty. That Bill and Melinda Gates Foundation, the WHO, and all these other huge conglomeracies with no accountability, with no control, with no means of unchecked power, can do whatever they want, can flourish people and abuse people for their own flourishes. It's just absolutely crazy. So this is from True North, the Minister of Health in Alberta, Adrian Lagrange, sounds the alarm on the federal government's C-293 bill and says it threatens Alberta's control over pandemic response and healthcare. The feds argue the bill aims to prevent the risk of and prepared for the future of pandemics. So this is alarming because you got the federal government giving up our sovereignty to the WHO to be responsible for healthcare in a crisis situation. Meanwhile, right now in Canada, we have a system that is regulated that the provinces are in control of their healthcare. Ontario is responsible for Ontario healthcare. Alberta is responsible for Alberta healthcare. That's how it's set up. That's how it plays out to be. That's how our system runs and functions. It may not function well right at this moment because of provincial corruption, but that's how it's always been to be. Now, you have the federal government giving that up. They're now taking that away from the provinces under this bill. And here's what the health minister of Alberta is going to warn you about.
To speak to the federal government's Bill C-293, an act respecting pandemic prevention and preparedness. Despite a lack of consultation with provinces and territories, the bill is now before the Senate, and Albertans should be concerned. The bill seeks to prevent the risk of and prepare for future pandemics through a national plan. The health and well-being of Albertans is our top priority. There is no argument that governments are responsible to prepare for their jurisdictions for public emergencies, including pandemics. All preparedness plans, however, are unique to each province and territory. They are responsive to the needs of their citizens, their well-being, and their livelihoods. These jurisdictional plans do not preclude the necessity of collaboration between all levels of government when it makes sense to do so. For example, efforts such as maintaining stockpiles of vaccines or personal protective equipment to ensure equitable distribution across the country, strengthening domestic manufacturing capacity, and enhancing support for public health and primary care systems certainly is ways that could be accomplished. However, the federal Bill C-293, Pandemic Prevention and Preparedness Act, raises notable jurisdictional concerns, particularly in how it outlines the federal government's approach to pandemic risk reduction. The bill proposes that the federal Minister of Health will, and I quote, prevent the risk of future pandemics, unquote. The list of measures that could be taken under such a law is limitless. As is the case with many of the federal government's bills, not only are they an overreach of jurisdiction and create redundancies of resources, but the loose language is open to dangerous interpretation and misuse of political and administrative powers during vulnerable times.
So that's just a snapshot of just how horrific it is. The fact that Canada is willing to give up its sovereignty in this bill. The fact that when the approach of a pandemic, which we don't even have a full understanding of what could be considered a pandemic, because not only did they try this with COVID, which we're not allowed to question or investigate or figure out exactly where this virus came from, how it orchestrated. We don't even have a full inspection or investigation on the gain of function research that Anthony Fauci is accused of, and the fact that could be leading to the virus and how corrupted that is. We don't even have any means of reporting on that because we're not allowed to question anything. We're not allowed to read anything. That was during the pandemic. Remember that? You're not allowed to read up on things. You're not allowed to investigate. You're not allowed to figure out things. You just got to go with the flow. And that was kind of the beta test of what's going to further approach this. This is all part of the bigger picture that measure, all those measures of the mandates, lockdowns, shutting down small businesses, making sure people are, complying to certain measures that they've been told on the media. That was all preempted for stuff like this. So that now the WHO or any other organization on the global scale can announce whatever is a pandemic and allow themselves to invest into our countries and take over our governments, take over our sovereignty, take over our laws, take over in totalitarian force. And it has nothing to do with health. It has nothing to do with safety. It has nothing to do with any public measure whatsoever. This is about control. This is about garnering control over civilians. And just like the movie Network from the 1970s pointed out, that this is the whole result. That you don't have countries, you just have a bunch of billionaires that run the entire globe. These maniacal, evil, sociopathic, narcissistic billionaires that run the entire globe, and the international transfer of dollars. That's all you have. You have no countries, you have no sovereignty because of stuff like this. You don't have the opportunity or the democratic opportunity to say anything about this. And it's going to get even worse the further this goes along. So it's just absolutely devastating. But here's back to remind people, this is back in 2010 when Theresa Tam, the current health minister of Canada, the federal health minister, made this alarming prediction back in 2010 in a documentary talking about a scenario where people could be arrested, people can be sent to detention centers, people can be maliced by the federal government, which is what happened during COVID, just 10 years after this, and put into a dystopian, totalitarian, Orwellian nightmare that now we're still living with. This was back in 2010. The health minister today told people about this. This is a glaring warning.
I think the public has to know this is one of the worst case scenarios in terms of an infectious disease outbreak, in that their cooperation is sought. If there are people who are non-compliant, there are definitely laws and public health powers that can quarantine people in mandatory settings. It's potential you could track people, put bracelets on their arms, have police and other setups to ensure quarantine is undertaken.
Yeah, who better to trust than the doctor with bad lighting to look like a supervillain, and, the dark music underneath it doesn't help. But just saying it openly. Like, just no remorse, no real emotional take through. Just, potentially we can arrest people. Potentially we could track them. Potentially we could do anything to these people. We don't care. We don't care about the response. We don't care about how it's going to affect health. And that's why the pandemic itself and all these lockdowns have came with huge amounts of glaring, alarming statistics that was not ever discussed in the lockdown measures. The fact that suicide rates are skyrocketing, the fact that drug abuse skyrocketed, the fact that people were becoming more alcoholics, the fact that people, mental health of children were at a alarming rate because they weren't allowed to go to school, they weren't allowed to see their friends, they weren't allowed to have socialized gatherings of groups of children, which is healthy for their development. Their reading, comprehension skills, their math skills were behind because they didn't get the proper education restricted by people like her. It's absolutely devastating. Absolutely devastating. And all that was just a built up to this bill. All of this is a built up to this bill, which they've already had been cooking for a long while. But luckily, COVID came around and, straightened people up. It was kind of the pretext warning of, hey, this is what's going to happen, and you're just going to have to like it. Just like how the Patriot Act, post 9/11, was actually written before 9/11. Did you know that? The Patriot Act that mass surveilled, got the TSA to, pat you down and basically give you a friggin' hand job at the airport. That was all before September 11th. But because of that horrific day, now they have an excuse. Now they have the opportunity to say, well, if you don't want another 9/11, you don't want another situation like that, you got to get this bill passed. Because we don't know what terrorists will be around. Just like this. Oh, we got to get this bill passed because you don't know what disease is going to come out next. And yet, there is no jurisdiction on the fact that still to this day, we have deadly gain-of-function research facilities still opening, still available, that's doing harmful damage to human society. That Anthony Fauci has not been prosecuted and will never be prosecuted. That we have people like Theresa Tam who openly state and giggle of the fact that, hey, we could just restrict the entire nation without any scientific inquiry or analysis to back those arguments. And that's why they lied about masking. They lied about they lied about everything. Every aspect of COVID was a lie. The 6-foot rule, the fact that they locked down businesses, the fact that, every single aspect of COVID was fundamentally a lie. And it was all done for the corrupt business practice of huge pharmaceutical giants, which just prior to COVID, people were angry at, people were vicious at. They were responsible for the opioid epidemic, which that has also increased during COVID. But there's still, it amazes me that even with all this, I still have people, holy crap, I still have people that still tell me that, well, we still got to mask up. We still got to do this. We still got to do this because there's diseases around all over the place. That they're okay. They're comfortable with measures like this. They're comfortable. Because, what's the worst Bill Gates can do? It's just absolutely astonishing that people were okay with this, that people were acceptant of this, and they're okay if it happens again. In fact, they're the ones that want to happen again. Because, oh my God, we're in cough and cold and flu season. My God, there's going to be sickness all over the place. But they never told you the truth of the last one. You're not allowed to investigate what happened during the last pandemic, but you got to prep for the next one. How about we actually prevent a pandemic from happening by not doing this, by making conscious decisions, by informing the public on actual health measures, getting vitamin D, talk about ivermectin, talk about hydroxychloroquine, talk about real measures by real doctors. Because that's what I did. That's what I did when I got vaccine injured the second time, and I'm still dealing with it. I eventually looked into it, and oh my God, turns out it was a big lie. Turns out it was a big manufactured lie. Just what I should have thought about back in the day, but I didn't know at the time. I was just like anybody else. But it is amazing to me that there's still people angry at me for pointing this out, and the fact that I revealed my journey of understanding this. People are still angry at me for that, but yet I'm not angry at them because they're just stuck into the mind warp of all this. They're getting delusional thoughts. They're getting stuck into this trance by people that are so evilly corrupted that they would deliberately lie to you right to your face, and the mainstream media just parrots it like a soundboard. So it's just absolutely devastating. Bill 293. People look into this, get the word out, because, oh my God, if this truly does pass, which I don't know if it does by the time you're watching this, if this truly gets out, there goes Canada. There goes your nation. Because yet we don't even know at what point and what time or when they'll call out a pandemic, which they probably will at some point. But this just gives up your entire sovereignty, not only of the entire nation, but provincial aspects, your civil rights, the fact that they'll track and surveil, and gives up all your medical privacy, which is supposed to be patient-doctor confidentiality. That's always been the case, but not with this.